Good morning, everyone, and welcome to this joint meeting of Government Operations, Fiscal Policy, Public Safety Committee, and Health and Human Services. So you have, I guess, most of the council with you today. We are here today to discuss and make a recommendation to the full council on the special appropriation number 24-39 OEMHS Respite Center for Arriving Migrants Grant Program for $2,261,666,000. The source of the funds is general funds undesignated. Before I turn it over to our staff to review, I just wanted to take a moment and say a few words and then see if my co-chairs would like to say anything. I was the mayor in Tacoma Park in the spring of 2002 when we started to receive migrants and asylum seekers by bus here in the DC region. Our city, people opened their homes, our churches opened their basements and other facilities. I was also on the COG board at that time working with colleagues in DC and in other jurisdictions, working with Delegate Charkoudian here and then Council President Gabe Albanaz. And it truly was and continues to be a crisis. And Montgomery County at that time stepped up and created the first respite center in the region that was a formal facility to help people have a place to shower, to get medical care, to get food. Because many of these people had literally traveled hundreds and hundreds of miles, were put on a bus, and sent here from Texas and other states with no rest or medical care. And we don't need to go into many of the stories. We heard some of them during the public hearing. I had the opportunity to tour the facility that we're talking about today and to meet the folks from SAMU and hear about their work. And I want to say I'm just thankful that here in Montgomery County we did this, and I believe we really did avert a crisis here for our county and set a model for the region. So I know today we're talking about this appropriations, but I just wanted to start before we get into questions about money and process and other things and looking forward to first say thank you to everyone who worked so hard. Thank you to my colleague who I know was instrumental in getting this done because it continues to be and was just the right thing to do. So I know Councilmember Albanaz would like to say a few words.
Thank you very much, Madam Chair. And let me just say what a continued privilege it is to be able to serve with this 20th Council and what a privilege it was to serve with the 19th Council. So almost 2 years ago, I had the opportunity to go down to McAllen, Texas and visit the border myself. And I spent 2 days with Sister Norma Pimentel, who is the Mother Teresa of our time, on her own 4 years prior to that during the Trump administration and some of the darkest days that our country has faced on immigration issues. She took it upon herself, along with some volunteers, to establish a respite center right on the border in McAllen, because there were thousands of people coming across the border, many women and children, who had, as the chair noted, spent days traveling in conditions and circumstances that are possible for any one of us to be able to fully comprehend or imagine. And all it was an opportunity for families to receive love, care, food, clothing, because more often than not, they were showing up with not much more than the clothes on their back. But they also got a bus ticket. And they helped them with a plan to get to their ultimate destination, because most of the people that were crossing had begun the initial process of seeking asylum within our country and had begun some level of legal status. When I went, they were averaging around 400 people per day. I spoke to Sister Pimentel about 3 months ago. They are now averaging at that same respite center 3,000. And these are folks that are coming over, and all of us, especially them, are victims to an unimaginably broken federal immigration system that people on both sides of the aisle agree is broken, but nobody seems to have the courage or the willingness or the know-how to get fixed. And consequently, as a result of that, local jurisdictions across the country, especially ones that welcome and celebrate our diversity, such as Montgomery County, are not just a destination spot, but a through spot for a number of residents that are trying to do what generations before them have and establish roots in our country to better their families and support their families. And so I, along with the 19th Council, in partnership with the executive and the executive branch, understood very quickly that it made not just moral sense for us to support these individuals, but it made financial sense, it made budgetary sense to be able to support people before they're in crisis, to be able to connect them to services that they frankly deserve and they are eligible for, but may not know exist. And if we don't do that on the front end, then we see what will have happened to other jurisdictions across the country, particularly New York right now, in which where there isn't the same infrastructure, they have a social safety net that is imploding. That is not the case in Montgomery County. And that is because we have been very intentional about our approach to this very complex issue that is not of our own making. And so we are here to talk about the continuation of those services because, as we know, we are continuing to have these challenges at the national level with many stories that we're reading about every day. I plan on going back to the border sometime in this upcoming calendar year. And I actually invite any colleagues that want to come with me to go observe for ourselves what's happening and see how we can better partner with some of the border states and cities because we are all inextricably linked in this extraordinary challenge and time. So I want to end and obviously turn it over to the important discussion we're going to have by echoing the thanks of my colleagues, the people who are on the front lines, who are dedicating their time, their energy, their love, their passion, and their support for people who so desperately need that help. I am proud to live in a county that recognizes and understands our role in this work. And as long as I'm breathing, I'm going to make sure that we continue it. Thank you.
Councilmember Katz?
Thank you very much, Madam Chair, and well said, Madam Chair and Councilmember Albornoz. This is another topic where, just like so many others that we're seeing pretty much every week, that involves so many of the council committees and so many of the different departments in the county. Councilmember Albornoz, I guess others have said it as well, obviously the immigration system in our country is broken, but we cannot wait for the federal government to fix it. We have to make certain that somebody who is that someone who is hungry, that of and in many cases their children who are hungry, that we make certain that they are taken care of. And from the public safety side, if we don't do those sorts of things, obviously people will do things that when they're desperate, they will do other things. So this is, to me, and we're going to get through the packet, but to me, this is the right way to take care of a very difficult situation. Thank you, Madam Chair.
Thank you very much. That's what happens when you have three committees. You have three chairs. I'd like to turn it over now to our staff, Ms. Clemens Johnson, to walk us through the packet, and then we'll turn it back to the council members.
Good morning, chairs and council members. Thank you so much. This appropriation is a grant program for SAMU First Response, which manages the Montgomery County Respite Center for arriving migrants in the amount of $2.2 million. $80,000 of the $2.2 million includes contract and administration support for the Department of Emergency Management and Homeland Security. The County Respite Center, as mentioned, was opened in June of 2022 with SAMU First Response providing centralized respite services, respite and support services for migrants arriving from the southern border to the region. The county's Respite Center was the first formal facility to open in the region to provide help and assistance for the needs for migrant families. SAMU operations in Montgomery County have been supported so far through FEMA emergency funds. In mid-2023, FEMA made changes to the emergency grant program, which SAMU was receiving funds through, facilitated by the United Way. And for the tranche of funds that were approved for the second half of 2023, SAMU and their services provided in Montgomery County were not included. So just to note, the county does not currently have a contract with SAMU, and this would be the first time the county is formally allocating funds for the respite center operations. I do want to note that the county facility has been provided in kind with overhead support provided by the county, and also utilizing the network of care and coordination and navigation services that exist in the county. So not direct funding support, but support overall. Council staff recommends approval of this special appropriation as recommended in order to maintain and continue services currently provided by SAMU First Response without replacing the federal funding. Services would stop abruptly and create an immediate gap in critical services for individuals and families. So, thank you.
Thank you very much. And we have, I know, a representative from SAMU here as well as the county exec's office. And so I think I'll just kick it off, and maybe for Dr. Stoddard, if you could go into just a little bit more detail regarding the need for the special appropriations right now, and then what are the plans for the future?
Sure. Good morning, Chairwoman and fellow chairs and council members on the Joint Committee. So first off, I want to say I want to echo everything the council has already said about the importance of doing this. I'm incredibly proud, but also not proud just from a human service perspective, but also from a pragmatic perspective that we did this when we did it, because I think, as was noted, we've seen across the country a lot of cities struggling with the burden that this has created. And I think we recognized pretty early on, not just from a human service perspective, which is frankly sufficient on its own, but from a continuity of operations perspective, we were concerned about the impact that this would have on our homeless shelter situation, things like that. We knew we couldn't sustain a huge surge in the existing system, so we had to create the respite center. And I think it's important to recognize that, and this remains the case, many of the people coming through the respite center are actually not staying long-term in Montgomery County. They're stabilizing here. We're helping them identify where their final destination may be. They're typically linking up with previously arriving communities, family members, friends, and traveling on. And we help through SAMU support that effort. But those residents, obviously, who do stay here, we obviously want to make sure that they are seamlessly integrated into the existing network of social services and other supports that exist in Montgomery County for newly arriving immigrants, and making sure that they're receiving culturally appropriate food and resources that are not as readily or routinely offered through some of our shelter environments or some of our other programs. This is sort of especially niche because these communities are coming in with a lot of trauma that is unique from the traditional shelter population. They also come in with needs, health needs that are different, and we want to make sure that we're respecting that in the facility. And so obviously, as was alluded to, this had previously been funded through federal grants that went via the United Way to SAMU. In July of this year, the United Way informed SAMU that they would not be continuing that partnership. And unfortunately, the first tranche of money that was available through the application closed the day after United Way informed SAMU of that. But also, the first round of funding was only open to previous applicants, which would have made it impossible for the county to have stepped in at that point and become the fiduciary agent. Obviously, we didn't have the time for the application, nor would we have been eligible for it because it was previous applicants only. And as council staff alluded to, the second round of funding, which we did partner with the District of Columbia, who also SAMU works with, so it was a seamless, it's been a collaboration since the beginning. That grant wasn't funded for DCR for us because they chose to focus on the border nonprofits and communities preferentially. And so our anticipation is that this supplemental appropriation would get us through into the next phase, potentially, of the application process. The reason, and we could talk a bit more about this, the reason why we've kept it in the Office of Emergency Management, not moved it to Health and Human Services, for example, is because it is still a crisis response, and candidly, we want to make it clear that it's still a crisis response in our county funding, so that we're still eligible for that crisis level funding that will come through FEMA next year. If we integrate it into our services, we have concerns that it becomes a supplanting issue, which, for those who are familiar with grants, is often a concern. If you start to fund something locally and then you seek federal funding for the same thing, they often will deny your funding by virtue of the fact that you've supplanted local funds. And so we're treating this very much as a sort of an emergency gap funding issue, as opposed to a long-term sustainment issue at this point. I think I'll stop there, because I think that I'm happy to answer questions that you all may have about the process, but obviously we think this funding is obviously important, not just from the human service perspective, but frankly from had conversations with members today as recently about our homeless shelter situation, and obviously we've got to meet the same issues that we were concerned about in 2022, if not more critically, are in place today, and we need to make sure that we preserve the system we have. We can't stop the buses from arriving. We can't stop the immigrants from arriving, not that we would want to, but this situation is not something that we have control over in terms of what we receive, to the extent that Texas is not a partner on this, as it were. And so obviously that's important for us to recognize that we have to manage the situation that we are faced with, and that we want to do it in the most humane, reasonable way for the county, for the people arriving and such.
Great, thank you. And I do want to just draw people's attention to the packet. I think it's on page 4, that the appropriations will serve around 1,500 people between January and June, and there is a breakdown of the funding request on the following page. Council Vice President Friedson.
Thank you so much. First of all, let me just acknowledge thank you for your leadership. Thank you to Councilmember Alvarez, who I know has been working on this since its inception and has been keeping all of us up to date on it, and just really appreciate his leadership on it. And thank you to the executive branch and SEMU and all the partners who have been part of this. I'm glad you started how you did, which is these services are necessary, and this discussion really isn't about that. It's a question of how do we fund it right now, and then how do we sustain it if it's necessary moving forward. So I absolutely think these services are necessary. I believe it's a moral obligation. I do have concerns about where do we go from here, and whether or not we are essentially picking up a federal responsibility. And I think we all kind of acknowledge that, but we can only pick up so much of the federal failure without them picking up the tab for what that failure costs. And in these costs, it's not financial costs, it's really human costs, which have financial costs. So my first question, and I appreciate you answering kind of the purpose of this and not moving into the base budget, keeping it in emergency management, viewing us as a crisis response, and the update on the DC piece. You also recognize that a lot of these folks are not staying in Montgomery County. They're not from Montgomery County, and they're not staying in Montgomery County. So we're picking up other regional responsibilities and national responsibilities as well. So where do we have an understanding of where some of the folks are going, and are we engaging any other places to help support the funding for this as well?
I think I'll ask Andrea from Salmon to come up and answer exactly where they're ending up, because I think she'll have much greater detail about the breakdown.
That'd be great.
I think.
And thank you again for
Yes.
the work that you're doing. It's not a question of whether it should be funded. It's a question of who really ought to be responsible for it, and not just now, but moving forward.
Let me say unequivocally, immigration is a federal responsibility. There's no question about this. We were extremely disappointed in the administration's decisions to focus all the resources on the border communities, not because they don't need resources, but because the need has now obviously gone beyond the border at this point, intentionally from some of the border states. And so, and candidly, there are nonprofits on the border who are now participating in the same busing process that the states themselves are participating in, because they recognize that places like Montgomery County have stood up resources. And so I think that unequivocally, our view is that, the federal government should get back to this. And I think we largely, if United Way had not stopped their being the intermediary, they would very likely be still funding it right now in Montgomery County today. And so I think it was we've already made clear that the next round of funding will not have the same requirement that you would be a previous recipient, which would have precluded us from stepping in this at this point. And so our anticipation is, and our expectation is, that the federal government's going to return to doing what it's been doing so far in a very controlled mechanism. So, Andrea.
Actually, before we turn to Samu, Dr. Stoddard, since we're on this piece, could you also speak to what's available at the state? Because the state is also has set up funding
Yes.
for this.
And thank you for reminding me. Actually, we have a meeting with Secretary Lopez from Human Services on Monday, and there is funding that's been set aside at the state level that we have reached out to the state about, and the anticipation is that any funding we receive from the state would reduce the need for this supplemental appropriation, and we'd inform the council as soon as we'll let you know after we have our meeting on Monday where this is likely to go. We're not going to ask for funds that we can get via some other mechanism at the state or elsewhere, and just so we're clear about that. And so we believe that the state will cover a portion of this. We just don't have certainty on when that would be and how much it would be. And obviously, with these funds being necessary prior to the council coming back in January, it was important for us to take action now to allow us to proceed with the contract development that has to happen with CMO, et cetera.
So the plan is essentially we're authorizing the funding, but you're seeking funding elsewhere.
Yes.
And so
we have to be able to
this
engage.
is an up to authorization, but not necessarily the
Precisely.
funding will be deployed immediately.
Precisely, because we need the authorization to be able to begin the contract development process that is required to have a relationship with and have the relationship with SAMU that we need to have going forward, because we don't have an appropriation upon which to base the contract.
I appreciate it. If you could answer where folks are coming from, then I have one other follow-up, if that's okay.
Of course. Good morning, everyone. It's a pleasure and an honor to be here. Thank you for the kind words. It really means a lot to us because we're really doing a lot of work. We do it. We care about the families. We care about the work that we do, and it's very good to hear it from council members. All of these comments are really appreciated. The migrants that are arriving to the area are having different destinations. It's a very fluid process. It's always evolving. So the data that I have in here is the most current one. It continues to change. Right now, the majority of families want to go to New York. That's their final destination, followed by New Jersey and other states like Florida, Illinois, Maryland, Pennsylvania, North Carolina, and Georgia. Those are the main states, and that makes up the huge part of the pie. The other is less than 2% and includes Massachusetts, Maine, Connecticut, Indiana, Virginia, Tennessee, and others.
Appreciate that. So, reinforcing the fact that this is absolutely a federal responsibility. Like we're stepping in here with county dollars for something that absolutely should be handled by the state, and it's not totally acceptable that they're not stepping up. Is there anything in the program moving forward that would make FEMA coverage of it ineligible, like that we'd have to roll back? Like, are there any standards that they have? Time, I know 30 days. There are certain requirements and restrictions. I just want to make sure. Can we make sure that we
Yes. We've been very
don't
intentional
do
about that,
anything
so-
moving forward that will preclude us from being able to capture the federal dollars because we're not using federal dollars now?
So good morning. I'll briefly touch on that. And one of the reasons why we're asking for some form of fiduciary support for the Office of Emergency Management and Homeland Security is just for that reason, is that we want to continue to hold SAMU, and I mean that respectfully, and any of our other vendors to the same standards that FEMA would hold them to in terms of reporting, compliance, grant regulations, so that they would roll very fluidly right back into that process so that we would not disqualify ourselves from that.
So it's no different on either side, on our
Exactly.
end or their end.
Exactly.
So that you're very cognizant of that. That's one of the benefits of having it in emergency management and not in HHS. How is DC covering their piece of it? Because they have a piece of it, we have a piece of this. My understanding is there's kind of cross
We have
referral dynamics here that they
DC is covering it with local dollars at this. Well, as soon as their federal appropriation ends, let me be clear about this. DC was getting a federal appropriation that did not cover nearly their costs, And so they will be covering a much larger cost. And I've heard numbers, and they are many times this appropriation size per month. They're multiples of this number per month in DC because they have a much larger pool of individuals that they're serving in DC. Part of our rationale for creating the Respite Center originally was to help, number one, begin to advocate around the region to say all of the jurisdictions should be taking a piece of this responsibility on, because it's unreasonable for any one jurisdiction to be overwhelmed in the way that, frankly, DC is being overwhelmed right now. And we thought it was a reasonable number for us to have 50 individuals in a facility in Montgomery County, and the intention was to process them through over a 3-day period and get them either into a more stable environment or get them to their next destination in a timely fashion. So we've designed it mechanistically to set a fair and reasonable level of support for Montgomery County, recognizing that this is a regional issue, and DC has taken on, frankly, a much greater size burden than is both reasonable and, frankly, I think the rest of the region would do well to help support the effort in the way that Montgomery County has, and not just left the district to handle it.
Okay, so, and then I'll close on this. So the plan is you're asking for authorization today, ultimately from the full council before we go into recess. You're continuing to seek funding from the state. That is intended to be bridge funding, and ultimately the goal is to seamlessly cover that bridge emergency funding to a joint federal FEMA grant with DC that is going to sustain this moving forward after the next several months.
Correct.
Okay. What is the timing of that? Because we do have, not related to this, but we have a very troubling pattern of supplemental and emergency appropriations that are coming through, some of which are unforeseen and some of which I think are more foreseen or could have been more foreseen. And so I just want to avoid the scenario. We're then heading into the budget. Mm-hmm. So at what point will we know how much of this money was needed and what is the funding mechanism for moving forward? When will you find out the federal funding question? When will you find out the state funding question? When will you be reporting back to the council, and what is the mechanism that you're going to do that with?
Yeah, so the state, let's talk about the state first. So the state has already got the money appropriated, so they just need to distribute it to whomever jurisdictions. And again, we've been told.
And it's appropriated for what? Like what pot of money are you?
There was, I believe, a $5 million appropriation that went to the Department of Human Services for this specific immigrant supports through the busing, right? It was basically specific support that went to Human Services that they have not at this point distributed any of that I'm aware of to any jurisdictions, and we've asked for.
So they could cover all of this.
They could theoretically cover all this.
And we're covering much of this work in the state.
Yes. Yes. But we've certainly asked for this number as the level of support that we're hoping to get. We won't know until.
Well, let us know what we can do
Yes.
to advocate at the highest levels at the state, because this is something that I think the state should help with. But what's the federal timing of it in terms of federal?
The next federal phase will probably be July of next year. Let me say.
Yeah, as far as the application period, it would be July of next year. The federal fiscal year, the actual distribution of funds would not occur until late September, early October of next year.
All right, so we have a timing and a math problem.
Correct.
So this isn't really what was suggested. It's not going to get us to June 30th, because
Well,
June 30th doesn't get us to where we need to go.
What we're hopeful for, and the consideration was originally, does this go in to the full budget ask for FY25, and that's where we got the fiscal year timeline there. The concerns about supplanting are very real, and we do not want to threaten our future funding for that. So I'm advising you guys candidly that we probably will not include that in our budget for that reason, knowing that we're going to be actively pursuing the federal dollars, but don't want to disqualify ourselves from those. So recognizing that there is
Once it's in the
Yeah.
base budget, it's now local dollars, and that hurts.
We think the risk increases exponentially if we put it in the base budget.
Got it. Okay. Well, I understand. So you're saying it's not going to be included in the base budget?
That's not our intention at this point at all. At all.
Okay. Well, I hope your intention and the reality meet. 'Cause it doesn't seem like it makes a whole lot of sense.
I'm not the county executive, so I don't decide what goes in the budget, but certainly he will not receive a recommendation for anyone at this dais to include in the base budget.
Okay.
And, yeah.
I hear you. I appreciate the caveat, but I appreciate the responses. I'll yield back.
And I do want to note, and thank you, Council Vice President Friedson, for those questions, that we do have strong advocates in Delegate Charkoudian, Delegate David Frazier-Hilago, who are strongly advocating for Montgomery County and were instrumental in making sure the state committed these funds. Any other colleagues? Any questions? Yeah. Councilmember Lukey.
Thank you. So just a quick question, and I don't want to overcomplicate things, but is there coordination between Department of Human Services at the state and MDEM on this? And is the FEMA funding coming directly from FEMA to the Office of Emergency Management and Homeland Security, or does it go from FEMA to MDEM to OEMHS? Sorry, too many acronyms. The Office of Emergency Management and Homeland Security. MDEM is the Maryland Department of Emergency Management, and DHS is the state's Department of Human Services.
So there's an interesting uniqueness to the way this funding is processed through the Emergency Food and Shelter Program and now the Shelter Services Program. So it's unlike our traditional Homeland Security grants, where it would go to a state administrative agent at the state level and then be passed through to a county entity. In this case, it's allocated directly to fiduciary agents. So what was the fiduciary agent in this case was United Way.
Okay.
So Montgomery County and Maryland, neither were parties in the actual fiduciary portion of this.
Okay.
Back to your question about how's the coordination happening at the state, MDEM is charged, Maryland Department of Emergency Management is charged with overseeing a work group that's multidisciplinary
Right.
across many organizations, as you know. So they are closely coordinating with DHS.
Okay.
What I would say is a feather in our cap is that they rely heavily on the Montgomery County model because we have leaned forward to this.
Right.
And they're looking to replicate that at the state level, which is their only reluctance to providing us with more funding is their fear that they will see the same influx in other jurisdictions that we've seen here. But with that said, I think that speaks volumes to the value that we're providing to this community and also the way that we're insulating the potential problem from impacting the rest of our society here. Because we are becoming the model for the state. So that's a little bit about the funding and the state model. I'm not sure if that answers both your questions.
Yeah, no, it definitely provides some clarity. And I guess my other question isn't, so understanding the procedural sort of nest of things that are going on right here that require us doing what we're about to do. And you all are absolutely certain that by us doing a supplemental appropriation doesn't in fact itself create a supplanting problem, because it would have been appropriated by the body in order to deal with the contracting issue that you have to deal with. But I have the lawyer in me has a little bit of heartburn over that, and I just want to flesh that out.
We certainly have some level of concern, and I will not throw United Way under the bus, but they have put us in a very, very difficult situation. Interestingly, we didn't ask the United Way to step in 2022. They stepped in by choice. We were prepared to be the fiduciary agent in 2022. The county was. They stepped in, and then when they removed themselves in 2023, it left us in a really difficult situation. And so I cannot with 100% assurance guarantee you that it would not be viewed as a supplanting issue. We're doing our due diligence here to try and minimize that risk by making it clear, even in the conversation here, that this is intended to be bridge and not a establishment of, and frankly, I'll be keeping this recording for the purposes of talking to FEMA when necessary. But that is not our intention. It's our intention for this to go back to being a grant-supported effort the way it would have been had United Way not remove themselves when they did. So There is risk. I cannot tell you that there is not risk, but we don't have a viable alternative that doesn't just shut the respite center down and creates a cascade of other
Right.
issues.
And I'm not asking you to tell me or disclose the legal advice that council would have given to the county executive's office, but presumably there has been legal advice that has been sought as to whether this quote-unquote bridge funding does or does not create a supplanting issue.
Yes, we're prepared to argue that it doesn't, and the county attorney has been engaged in that discussion. And yes.
Awesome. Thank you.
And if I could just,
Yeah.
council staff also will be happy following this work session to work with executive staff to ensure that the resolution that the council is scheduled to take up on the 12th has any language in it that might be helpful, both on this point as well as on the state funding point, to be just, again, clear that those mechanisms we'll leave as much room for those to be exercised as possible, and we'll work on that.
Yeah, I mean, this is an emergency situation. This is a situation that is unlike, most other types of, we're seeking a grant, the grant hasn't arrived yet, we have to do the things. This is an emergency. And so I do believe posturally it is different, but I just wanted to make sure we all have our full awareness of the posture that we're in. Thank you.
Thank you. Councilmember Sales.
Thank you, Madam Chair, and thank you to all of our panelists. I know this is a difficult time, but your response has just been tremendous. What we've seen over the past few years, it's honestly cruel what's happening, especially the time of the year when migrants are being bused to our communities. Not just being bused in the dead of winter, but lied to, deceived when they're supposed to be welcomed, and especially when they're seeking refuge at some of their lowest moments. And just glad that not just our county, but the region is covering each other to support this community. Council staff noted in the packet that there is no existing contract between SAMU and the county. And so will there be some sort of MOU before
Yeah, so tactically, the way we're going to be handling this, if approved, is that we would go through it as a grant to the Office of Grants Management. That expedites the process a bit and simplifies the legal mechanisms required. It would still have the same scope of work, the same reporting requirements. It would just expedite the procurement process. That being said, if council names SAMU in the legislation as has been proposed, then that also bypasses a lot of our procurement hurdles that normally take up some time. So we have strategized in such a way that this would expedite it so that there is no threat to the timing of this, knowing that it is very time sensitive.
Okay. And these resources would be for the entire fiscal year or the first 6 months? Do we have a timeline for?
These resources are budgeted to cover until the end of June of 2024.
Okay. All right. Thank you.
Councilmember Mink.
I just wanted to double down on ensuring that the council, in whatever ways that we can be helpful with advocating in the next step of this, we really want to make sure that we're ahead of the game as much as possible and that we're doing whatever we can do. Obviously, this is going to be a high priority for everybody else. We don't want to leave any money on the table. And a huge, huge appreciation to Councilmember Albanos for your work over the years and getting this into place, and to Chair Stewart for the intensive work on this complicated issue along with the executive branch, and look forward to next steps, and grateful also to the work of our state delegates. Thanks.
Councilmember Albanos.
Thank you very much, everyone. Those were excellent questions. Appreciate the responses. It's just the practical reality of the situation we find ourselves. But we are going to continue to be leaders in this space, and I would like to formally move the appropriation of $2,261,663.
Great. Do I have a second?
Second.
Everybody second. Councilmember Cat. All those in favor of recommending this to the full council? Any opposition? No? All right. And I will just note, as Ms. McGuire discussed, that we will have the resolution language. We will work with the executive's office to make sure it is reflective, that this is intended to stay with our Office of Emergency Services, that this is a bridge grant that we are looking at, that we are seeking the FEMA reimbursement and assistance from the state in these services, and that Montgomery County continues to be a leader in this issue to assist migrants who are coming to our area and need these services. Ms. McGuire, was there anything else that I missed?
No, I appreciate that. I wanted to clarify that again, the resolution, we will have additional language, and before the council sees it again on the 12th, the resolution will be different at that time, but it'll reflect the measures that you spoke about, as well as I think some of the other technical issues related to the Office of Grants Management that were mentioned here. I think we would just, again, want to be sure that the resolution reflects everything that needs to be accomplished.
Terrific, and we look forward to getting an update after the meeting with the state on Monday, and I am sure the chair of HHS will be taking this up as we're looking at long-term how to support this work. I thank you very much for coming and all the work that SAMU is doing, and with that, this session is closed. Thank you, everyone.
15 minutes.